Now, I know that turning 50 can be a scary milestone for some of us, but it's important to be aware of your heart health as you get older. After all, heart disease is the leading cause of death for both men and women in the United States. That's why it's so important to be aware of the warning signs and to take care of your heart and finish this entire video. Let's start by talking about some of the most common warning signs to look out for. Chest pain or discomfort is a big one. This can be a feeling of pressure, fullness, or squeezing in your chest. It's important to pay attention to this, as it could be a sign of a heart attack. Heart attacks are caused by a blockage in the blood vessels that supply blood to the heart. When this happens, the heart doesn't get enough oxygen and nutrients, and it can be damaged. If you experience chest pain, it's important to call 911 immediately, as time is of the essence when it comes to treating a heart attack. The sooner you get treatment, the less damage there is likely to be to your heart. Shortness of breath is another warning sign to be aware of. If you're having trouble catching your breath or feeling winded, especially during physical activity, it could be a sign that your heart isn't functioning properly. This could be a sign of heart failure, which occurs when your heart isn't able to pump enough blood to meet the needs of your body. When the heart isn't working effectively, it can't deliver enough oxygen and nutrients to the rest of the body, and you may experience symptoms like shortness of breath. Heart failure can be caused by a variety of factors, including high blood pressure, coronary artery disease, and diabetes. Pain in your arms, back, neck, jaw, or stomach is another warning sign to watch out for. This is often described as a radiating pain and can be a sign of angina, which is a type of chest pain caused by reduced blood flow to the heart. Angina is typically triggered by physical activity or stress, and it usually goes away with rest. Angina can be a warning sign of a heart attack, so it's important to pay attention to this symptom. Fatigue, dizziness, and lightheadedness are also warning signs to be aware of. If you're feeling excessively tired, dizzy, or lightheaded, it could be a sign that your heart isn't pumping enough blood to the rest of your body. Fatigue, dizziness, and lightheadedness can also be caused by other factors, such as anemia, low blood sugar, or certain medication. In addition to these warning signs, there are a few other symptoms to be aware of that could indicate a problem with your heart. Swelling in your ankles, feet, or abdomen can be a sign of heart failure, as fluid can build up in these areas when the heart isn't able to pump efficiently. If you notice that your clothes or shoes feel tighter than usual, or if you have a hard time fitting your rings over your swollen fingers, it could be a sign of a heart problem. Rapid or irregular heartbeat, also known as palpitations, can be a sign of an abnormal heart rhythm. Palpitations can feel like your heart is racing, pounding, or fluttering, and they can be alarming. But in many cases, palpitations are harmless and can be caused by things like stress, caffeine, or exercise. Abnormal heart rhythms, also known as arrhythmias, can be caused by a variety of factors, such as high blood pressure, heart disease, or certain medication. In some cases, arrhythmias can be serious and even life-threatening. Persistent cough or wheezing could also be a sign of a heart problem. If you're coughing a lot, or if you have a wheezing sound when you breathe, it could be a sign of heart failure. Fluid can build up in the lungs when the heart isn't able to pump efficiently, and this can cause coughing or wheezing. If you're experiencing these symptoms and they don't go away after a week or two, it's also a good idea to speak with a healthcare professional if you have a cough that produces a lot of phlegm, as this could be a sign of heart failure or another underlying condition. Heartburn or indigestion that doesn't go away can also be a warning sign of a heart problem. While heartburn and indigestion are common and can be caused by things like spicy food or overeating, persistent or recurrent symptoms could be a sign of something more serious, such as heart disease or even a heart attack. Heartburn occurs when acid from the stomach refluxes into the esophagus, and it can cause a burning sensation in the chest. Indigestion is a term used to describe discomfort in the upper abdomen, and it can be caused by a variety of factors. If you're experiencing heartburn or indigestion that doesn't go away or that is accompanied by other warning signs like chest pain or shortness of breath, it's important to note that these warning signs can have other causes as well, and they don't always mean that you have a heart problem. But if you're experiencing any of these symptoms, it's always a good idea to speak with a healthcare professional and get checked out. Don't ignore these warning signs. Your heart health is too important to take chances with. So take care of yourself and take care of your heart. With a little effort and attention, you can keep your heart healthy and strong for many years to come. Eat a healthy diet, get plenty of exercise, and try to manage any stress or anxiety you may be feeling. Don't smoke, and try to limit your alcohol consumption. And if you have any underlying health conditions such as high blood pressure or diabetes, it's also a good idea to know your family medical history, as heart disease can run in families. If you have a family history of heart disease, you may be at an increased risk and should be extra diligent about taking care of your heart. And last but not least, don't be afraid to speak up and advocate for your own health. If you have concerns or questions, don't hesitate to bring them up with your healthcare professional. It's important to feel comfortable and confident in your healthcare, and to make sure you're getting the care and attention you need. So there you have it. Some warning signs to look out for if you're concerned about your heart health after the age of 50. Take care of yourself and take care of your heart.